Question 1. Which symptom would prompt the nurse to prioritize isolation precautions for a patient with suspected typhoid fever? A. Abdominal bloating. B. Rose spots on the trunk. C. Profuse diarrhea. D. Constipation. Answer. C. Profuse diarrhea. Question 2. A nurse is assigning rooms for 4 patients. Which patient with typhoid fever should be given a private room? A. A patient with rose-colored rash. B. A patient receiving ceftriaxone. C. A patient with fecal incontinence. D. A patient who is afebrile for 24 hours. Answer. C. A patient with fecal incontinence. Question 3. Which task related to a typhoid fever patient can be safely delegated to a UAP? A. Administering oral antibiotics. B. Monitoring for gastrointestinal bleeding. C. Collecting a stool specimen. D. Educating about hand hygiene. Answer. C. Collecting a stool specimen. Question 4. What is the nurse's priority when caring for a dehydrated patient with typhoid fever? A. Providing a soft diet. B. Monitoring abdominal girth. C. Initiating for fluid resuscitation. D. Repositioning every 2 hours. Answer. C. Initiating for fluid resuscitation. Question 5. Which finding requires immediate notification of the healthcare provider in a patient with typhoid fever? A. Mild headache. B. Rectal temperature of 100.4 degrees Fahrenheit. C. Distended, rigid abdomen. D. Bradycardia. Answer. C. Distended, rigid abdomen. Question 6. Which action is appropriate when caring for a patient diagnosed with typhoid fever and acute confusion? A. Keep bed in high Fowler's position. B. Request a sitter to prevent falls. C. Turn off the room lights. D. Assign the patient to a double room. Answer. B. Request a sitter to prevent falls. Question 7. What is the nurse's priority during medication administration for a patient with typhoid fever receiving ciprofloxacin? A. Assess for tendon pain. B. Check for constipation. C. Monitor liver enzymes. D. Evaluate serum potassium. Answer. A. Assess for tendon pain. Question 8. Which nursing intervention is most effective in preventing transmission of typhoid fever in a hospital setting? A. Wearing an N95 mask. B. Placing patient in airborne isolation. C. Strict hand hygiene before and after patient contact. D. Wearing gloves when giving oral medications. Answer. C. Strict hand hygiene before and after patient contact. Question 9. Which patient scenario should be addressed first by the nurse? A. A typhoid patient reporting dizziness after ambulating. B. A typhoid patient with a sudden drop in blood pressure. C. A typhoid patient complaining of abdominal cramps. D. A typhoid patient with decreased appetite. Answer. B. A typhoid patient with a sudden drop in blood pressure. Question 10. Which patient teaching point is a priority for a client recovering from typhoid fever? A. Avoid dairy for 2 weeks. B. You can return to work after you feel better. C. Wash your hands thoroughly after using the bathroom. D. Take multivitamins to improve immunity. Answer. C. Wash your hands thoroughly after using the bathroom. Question 11. A nurse receives lab results for 4 typhoid fever patients. Which result should be reported immediately? A. Elevated AST and ALT. B. Positive Widal test. C. Hemoglobin of 9.8 g/dl. D. Platelet count of 60,000/mm superscript 3. Answer. D. Platelet count of 60,000/mm superscript 3. Question 12. Which patient care task must the RN perform for a client with typhoid fever? A. Feeding the patient soft diet. B. Administering for ceftriaxone. C. Measuring intake and output. D. Performing oral care. Answer. B. Administering for ceftriaxone. Question 13. Which assessment finding would the nurse expect in a client with early typhoid fever? A. High fever with bradycardia. B. Explosive watery diarrhea. C. Severe jaundice. D. Hyperactive bowel sounds. Answer. A. High fever with bradycardia. Question 14. A nurse is caring for a patient with suspected typhoid fever. What should be collected first for diagnosis confirmation? A. Urine culture. B. Stool specimen. C. Throat swab. D. Blood culture. Answer. D. Blood culture. Question 15. What is the best way to monitor therapeutic response to antibiotics in a hospitalized patient with typhoid fever? A. Decrease in abdominal distension. B. Normalization of body temperature. C. Absence of rose spots. D. Improvement in appetite. Answer. B. Normalization of body temperature. Question 16. Which patient with typhoid fever is safe to assign to an LPN? A. A patient needing 4 fluid bolus. B. A patient in septic shock. C. A patient receiving oral antibiotics and vital signs monitoring. D. A patient needing discharge education. Answer. C. A patient receiving oral antibiotics and vital signs monitoring. Question 17. What would be a red flag indicating intestinal perforation in a typhoid patient? A. Generalized abdominal pain. B. Watery diarrhea. C. Increased flatulence. D. Mild nausea after meals. Answer. A. Generalized abdominal pain. Question 18. During discharge planning, what is the priority education for a patient with typhoid fever? A. Limit fluid intake until appetite returns. B. Avoid close contact with pets. C. Continue antibiotics until completed even if symptoms improve. D. Do not resume physical activity for 2 months. Answer. C. Continue antibiotics until completed even if symptoms improve. Question 19. Which scenario requires the nurse to intervene during care of a patient with typhoid fever? A. UAP assisting the patient to ambulate. B. Family member offering outside food. C. Nurse wearing gloves during oral care. D. Patient being monitored for vitals every 4 hours. Answer. B. Family member offering outside food. Question 20. A patient with typhoid fever begins vomiting repeatedly and becomes lethargic. What is the nurse's priority? A. Administer prescribed antiemetics. B. Start for fluid resuscitation. C. Insert a nasogastric tube. D. Reassess temperature and document. Answer. B. Start for fluid resuscitation. Question 21. Which clinical manifestation in a patient with typhoid fever indicates worsening of the condition? A. Resolving rash. B. Persistent high-grade fever after 5 days of antibiotics. C. Mild abdominal discomfort. D. Decreased appetite. Answer. B. Persistent high-grade fever after 5 days of antibiotics. Question 22. What dietary advice is appropriate for a patient recovering from typhoid fever? A. High-protein, low-residue diet. B. High-fat ketogenic diet. C. Raw vegetables and fruit. D. Spicy food with added fiber. Answer. A. High-protein, low-residue diet. Question 23. A patient with typhoid fever is receiving ciprofloxacin. What should the nurse teach to prevent complications? A. You may skip doses if you feel better. B. Avoid exposure to sunlight during therapy. C. Take this medication with antacids for better tolerance. D. Stop medication if nausea occurs. Answer: B. Avoid exposure to sunlight during therapy. Question 24. A nurse is prioritizing care for 4 patients. Which typhoid patient needs immediate attention? A patient with a WBC count of 4,000/mm superscript 3. B. A patient with a soft, distended abdomen. C. A patient with sudden drop in LOCD. A patient with a dry mouth and fatigue. Answer: C. A patient with sudden drop in LOC. Question 25. Which lab finding supports a diagnosis of typhoid fever? A. Elevated lipase. B. Positive blood culture for Salmonella typhi. C. Positive rapid strep test. D. Elevated BNP. Answer: B. Positive blood culture for Salmonella typhi. Question 26. What nursing intervention helps reduce the risk of gastrointestinal bleeding in a hospitalized typhoid patient? A. Encourage walking after meals. B. Administer proton pump inhibitors as prescribed. C. Withhold fluids during fever. D. Give high-fiber foods. Answer: B. Administer proton pump inhibitors as prescribed. Question 27. A patient with typhoid fever refuses to take oral fluids. What is the nurse's priority action? A. Document the refusal. B. Encourage fluid intake after meals. C. Assess for signs of dehydration. D. Provide fluid via nasogastric tube. Answer: C. Assess for signs of dehydration. Question 28. A nurse is teaching staff about preventing the spread of typhoid in a community clinic. What should be emphasized? A. Use of airborne precautions. B. Frequent linen changes. C. Proper hand washing and sanitation. D. Isolation for 21 days post-discharge. Answer: C. Proper hand washing and sanitation. Question 29. What finding requires urgent intervention in a child with typhoid fever? A. Dry lips and cracked tongue. B. Tenderness in the right lower quadrant. C. Sudden abdominal guarding. D. Pale conjunctiva. Answer: C. Sudden abdominal guarding. Question 30. What is the rationale for avoiding NSAIDs in typhoid fever unless necessary? A. They increase the risk of constipation. B. They may lower the seizure threshold. C. They can worsen gastric irritation and bleeding risk. D. They interfere with antibiotic absorption. Answer: C. They can worsen gastric irritation and bleeding risk. Question 31. Which discharge instruction is critical for a food handler recovering from typhoid fever? A. Return to work as soon as your fever subsides. B. Avoid hand washing with hot water. C. You must be tested to confirm you're not a carrier before returning to work. D. Start probiotics after 3 days of antibiotics. Answer: C. You must be tested to confirm you're not a carrier before returning to work. Question 32. A nurse suspects perforation in a typhoid patient. What is the most appropriate nursing action? A. Encourage ambulation. B. Reassess temperature. C. Notify the provider and prepare for surgery. D. Give oral fluids. Answer: C. Notify the provider and prepare for surgery. Question 33. A patient on ciprofloxacin develops heel pain. What should the nurse do first? A. Encourage ambulation. B. Report the symptom to the provider. C. Discontinue the medication independently. D. Apply warm compresses. Answer: B. Report the symptom to the provider. Question 34. Which condition may mimic typhoid fever and should be ruled out during assessment? A. Appendicitis. B. Migraine. C. Bronchitis. D. Otitis media. Answer: A. Appendicitis. Question 35. What is the best method to confirm resolution of typhoid fever in a patient? A. Disappearance of rash. B. Patient reports feeling well. C. Negative blood and stool cultures. D. Return of appetite. Answer: C. Negative blood and stool cultures. Question 36. A family member asks if the typhoid patient can use a shared bathroom. What is the nurse's best response? A. Yes, as long as gloves are worn. B. Yes, if strict disinfection is done after each use. C. No, the patient needs an isolation bathroom. D. No, this condition is airborne. Answer: B. Yes, if strict disinfection is done after each use. Question 37. Which task can the RN delegate to the LPN for a patient with typhoid fever? A. Assess for abdominal distension. B. Administer oral antibiotics. C. Develop a teaching plan. D. Monitor for signs of shock. Answer: B. Administer oral antibiotics. Question 38. What is the priority infection control measure in typhoid endemic regions? A. Boiling drinking water. B. Avoiding meat. C. Limiting travel during rainy season. D. Wearing insect repellents. Answer: A. Boiling drinking water. Question 39. What type of isolation precaution is required for a hospitalized typhoid fever patient? A. Airborne. B. Droplet. C. Contact. D. Standard. Answer: C. Contact. Question 40. What is the nurse's best response when a patient with typhoid fever asks when they will stop being infectious? A. After 2 days of antibiotics, the infection is gone. B. You're no longer contagious once the fever resolves. C. You may remain infectious until stool cultures are negative. D. You are infectious only while you have diarrhea. Answer: C. You may remain infectious until stool cultures are negative. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying!